Okay, so hello class. This is the part of your Module 1 Organic Pharmaceutical Chemistry. So, the first question, the ratio of disinfectant to the dilution of phenol required to kill a given strain of the bacterium. Your choices here, phenol number, phenol coefficient, and phenol value. The answer is phenol coefficient. So, what is phenol coefficient? It is defined as the ratio of a disinfectant to the dilution of phenol required to kill a given strain of Salmonella typhi. So, a disinfectant over dilution of phenol. That is your phenol coefficient. So the phenol coefficient of phenol is constant, which is your number 1. So I repeat, your phenol coefficient is defined as the ratio of disinfectant to the dilution of phenol required to kill the bacterium Salmonella typhi. Okay, number 2, the generic name of Nizoral. That is your ketoconazole, which is used as a synthetic antifungal. So your Nizoral is a synthetic antifungal agent. And also, it belongs to the class of imidazoles. So for your meconazole, nakalagay dyan, brand names for meconazole or miconazole, Monistat and Micatin. For your Clotri, which is your Lotromine and Miselex. Your potassium sorbate, however, is an antifungal preservative which is used in your syrups or elixir. So the answer here is letter C. So your azoles belong to substituted imidazoles. Your azole belong to the substituted imidazoles. Number 3, sulfonamides used for burn therapy. Your answer here is letter C, both mafenide and silver sulfadiazine. So sulfonamides used for burn therapy, your mafenide and your silver sulfadiazine. So for your mafenide and your silver, they are structural analogs and competitive antagonists of para-amino benzoic acid or your PABA and prevent normal bacterial use of PABA for the synthesis of folic acid. So they are extensively used for UTI and for burn therapy. So sulfonamides generally are used in the treatment of your urinary tract infection and for burn therapy, and examples of this are your mafenide and your silver sulfadiazine. So brand name of your mafenide is sulfamylon, and for your silver sulfadiazine naman, brand name Silvadin. So I repeat, the examples of your brand name of mafenide, sulfamylon, and for your silver sulfadiazine is your Silvadin. So the answer here is letter C, both A and B. Number 4, the following are preservatives except your letter A, which is andesilenic acid, which is an antifungal, and the rest, methylparaben, benzoic acid, and potassium sorbate are examples of your preservatives. So your undesilenic acid, it is a synthetic antifungal agent obtained from destructive distillation of your castor oil. So I repeat, undesilenic acid is a synthetic antifungal agent obtained from the destructive distillation of your castor oil. So your methylparaben, it is a para-hydroxybenzoic acid. Methylparaben is a para-hydroxybenzoic acid, primarily used to protect against molds, whereas your benzoic acid and your potassium sorbate are antifungal preservatives. Number 5, the combination of trimethoprim and sulfamethoxazole is also known as your cotrimoxazole, and this is your drug of choice for chronic urinary tract infection. So, it is the DOC for UTI, your cotrimoxazole, a combination of sulfamethoxazole plus trimethoprim. Number 6, a polyene antifungal antibiotic, that is your letter B, nystatin. So, polyene antibiotics were first isolated from soil bacteria. Your amphotericin B from Streptomyces nodosus. Amphotericin B is isolated from Streptomyces nodosus. Your nystatin is isolated from Streptomyces norsei. That is your example of polyene antibiotics. Your griseofulvin here is isolated from the mold Penicillium griseofulvin, which is an antifungal antibiotic, but it is not a polyene antifungal. And your iconazole is a substituted imidazole used topically. And your salicylic acid is a synthetic antifungal agent with keratolytic property. So, the only polyene antifungal here is your nystatin together with your amphotericin B. Ayan. Number 7, benzylpenicillin is also known as PenG or your penicillin G. So, penicillin G or benzylpenicillin. Your PenV here is your phenoxymethylpenicillin. PenV, phenoxymethylpenicillin. Your ampicillin is D-alpha-aminobenzylpenicillin. D-alpha-aminobenzylpenicillin, which are degraded by beta-lactamase leading to inactivation, while your oxacillin is also known as your 5-methyl-3-phenyl-4-isoxazolyl penicillin, which is a beta-lactamase resistant. So, let's repeat. Your PenG is known as benzylpenicillin. Your PenV is known as phenoxymethylpenicillin. Ampicillin is D-alpha-aminobenzylpenicillin, which are degraded by beta-lactamase, leading to their inactivation. And your oxacillin is known as 5-methyl-3-phenyl-4-isoxazolyl penicillin, which is a beta-lactamase resistant. Number 8, first generation urinary tract anti-infective is your nalidixic acid. So, first gen is your nalidixic acid. The primary use of your nalidixic is for the treatment of urinary tract infection. Okay, number 9, fluoroquinolone A fluoroquinolone is your norfloxacin. So, the first fluorinated quinolone is your norfloxacin, which is effective against gram-negative, gram-positive organism in treating urinary tract infection, prostatitis, but not in systemic infection. So, your norfloxacin is the first fluorinated quinolone which is effective against gram-negative and gram-positive for the treatment of UTI and prostatitis. Number 10. Number 10. Combination therapy in the treatment of tuberculosis, which contains the following drug except streptomycin. So your ethambutol, rifampin, and isoniazid are the combination therapy for the treatment of tuberculosis. So the agent responsible for tuberculosis is your Mycobacterium tuberculosis. So the short course therapy for tuberculosis includes your isoniazid, rifampin, and pyrazinamide for 2 months. And then isoniazid, rifampin for the next 4 months. And then, or ethambutol may be added to the regimen. So for the first 2 months, the treatment or the therapy used for your tuberculosis are isoniazid, rifampin, and pyrazinamide for 2 months. And then, for the next 4 months, isoniazid and rifampin and ethambutol may be added to the regimen. Okay, nakuha yun. Next, number 11. These drugs are used in the treatment of amoebic dysentery except your chloroquine. So, your tinidazole, etofamide, and metronidazole are used in the treatment of amoebic dysentery. And the drug of choice for amoebic dysentery is your metronidazole. So, metronidazole is the drug of choice for amoebiasis, and the cause of amoebiasis is Entamoeba histolytica, Giardiasis caused by Giardia lamblia, and trichomoniasis caused by Trichomonas vaginalis. So, the drug of choice for your metronidazole is the drug of choice for amoebiasis, Giardiasis, and trichomoniasis. So, for amoebiasis, the causative agent is Entamoeba histolytica. For Giardiasis, Giardia lamblia, and for trichomoniasis, Trichomonas vaginalis. That is for your metronidazole. Number 12, a 4th generation cephalosporins is your cefepime. So take note, for your 1st generation cephalosporin are your cephalosporin, which spells CEPH, your Cef. That is for your 1st gen. Your 2nd gen naman is Cef as in CEF, but do not end in 1 and in ime. And your 3rd gen end in one enzyme except your cefdinir, and your fourth generation is your cefepime. I will just send the copy for your first gen, second gen, and third gen and fourth gen cephalosporins. So the answer here for fourth generation is your cefepime. Your cephaloxin is a second generation. Your cefamandole is a second generation. And your cefuroxime is a third generation cephalosporin. Okay, number 13. The drug is used in the treatment of chickenpox. That is your acyclovir. So, acyclovir is used in the treatment of chickenpox. And the causative agent of your chickenpox is your varicella zoster virus. While your zidovudine is a drug used in the treatment of HIV and AIDS. Your zidovudine is used in the treatment of AIDS and HIV infection. Your metronidazole is for the DOC for the treatment of amoebiasis, giardiasis, and your trichomoniasis. And your chloroquine is the drug of choice for the treatment of erythrocytic falciparum malaria, except in the resistant strains. So let's repeat. Your zidovudine is used for the treatment of HIV infections and AIDS. Your chloroquine is used for the drug of choice for erythrocytic falciparum malaria, except for the resistant strains. Your acyclovir is used for the treatment of chickenpox, and its causative agent is varicella zoster virus. And for your metronidazole, it is the drug of choice for amoebiasis, giardiasis, and trichomoniasis. So the answer here is letter C. Number 14, the drug of choice for typhoid fever. The drug of choice for typhoid fever is your chloramphenicol. So, chloramphenicol is not only against bacteria but also against rickettsia. So, it is the drug of choice for typhoid fever and also used in the treatment for against rickettsia organisms. Number 15, the generic name of dalacin C, which is often used to treat pimples, is your clindamycin. So, your clindamycin is recommended for the treatment of upper respiratory, skin, and tissue infections caused by susceptible bacteria. So, the brand name of clindamycin is your dalacin C. Okay. Number 16, the study of chemical agents which are selectively more toxic to the invading organisms than the host is your chemotherapy. So that is your definition of chemotherapy, the study of chemical agents which are selectively more toxic to the invading organisms than the host. So, Paul Ehrlich is the father of chemotherapy. The father of chemotherapy, Paul Ehrlich. 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 Okay, number 17. compound that kill or prevent the growth of microorganisms when applied to living tissues. So take note, living tissues, meaning that is your antiseptics. For disinfectant, that is for non-living tissues or inanimate objects. Okay, number 18. A combination of non-ionic and cationic surfactants with iodine is your povidone iodine. So, povidone iodine is the combination of non-ionic and cationic surfactants plus iodine. So, iodine is one of the oldest known and one of the most effective useful germicides available today. So, povidone iodine, brand name betadine. Brand name of povidone iodine is your betadine. Number 19. The generic name of new mertiolate is benzalkonium chloride. The generic name of new mertiolate is benzalkonium chloride, letter D. It is a cationic surfactant which possesses detergent, emulsifying, and wetting action. So, it is employed as an antiseptic for skin and mucosa and for irrigation or storage of surgical instrument. So, benzalkonium chloride is the new mertiolate which is used as an antiseptic used in detergent, emulsifying, and wetting action. Your chlorhexidine gluconate has a broad spectrum antibacterial activity but is not active against acid-fast bacteria, spores, or viruses. So, it is used as topical antiseptic for preoperative skin disinfections, wound irrigation, bladder irrigation, mouthwashes, and general sanitation. And your thimerosal, this is your old mertiolate. Your thimerosal is your old mertiolate. It is a mercury-containing compound and it is a weak bacteriostatic that is applied topically as an aqueous solution or as an ointment. So, your new mertiolate is your benzalkonium chloride and your thimerosal is your old mertiolate. Okay. Number 20. The mechanism of action of quinolones is inhibition of DNA gyrase. Inhibition of DNA gyrase. Number 21. Prodrugs of active antimalarial metabolites, the dihydrotriazines. Prodrug of active antimalaria metabolites, the dihydrotriazines, are your biguanides. Biguanides. Number 22. 7-chloro-7-deoxylincomycin is your clindamycin. So, the chemical structure for or chemical name of your clindamycin is 7-chloro-7-deoxylincomycin. Number 23. The drug is effective against both exoerythrocytic and erythrocytic forms of malaria. That is your letter D, cycloguanil. Cycloguanil. So again, your chloroquine. Here is the drug of choice for the treatment of erythrocytic falciparum malaria except in resistant strain. Your amodiaquine is highly suppressive in Plasmodium vivax and Plasmodium falciparum infections, being 3 to 4 times as active as quinine. And your cycloguanil is the DOC for both exoerythrocytic and erythrocytic forms of malaria. Ayan. So, if the question is the DOC for exoerythrocytic and erythrocytic, that is your cycloguanil. If the question is DOC for erythrocytic forms, except in resistant strains, that is your chloroquine. Okay. Number 24. Newest and most potent quinoline derivative for malaria is your mefloquine. So, mefloquine is the most promising of the group of new anti-malarial drugs and has become the drug of choice for malaria suppression. So, the DOC for malaria suppression is your mefloquine. And it is the newest and most potent quinoline derivative. That is your mefloquine, letter B. Number 25, an aromatic diamide derivative used for sleeping sickness is your letter B. Pentamidine. So, aromatic diamide derivative used for sleeping sickness is your pentamidine. Your sleeping sickness is also known as your trypanosomiasis, refers to two chronic and fatal disease caused by your trypanosoma. There are types of trypanosoma or your sleeping sickness. Your African sleeping sickness, causative agent is Trypanosoma brucei, gambiense, and Trypanosoma brucei. While for American sleeping sickness, the causative agent is Trypanosoma gondii, ayan. So, there are two types of trypanosomiasis, that is your African sleeping sickness and your American sleeping sickness. For our African sleeping sickness, the causative agents are 1. Trypanosoma brucei and gambiense, and Trypanosoma brucei. While for American sleeping sickness, the causative agent is Trypanosoma gondii. And your pentamidine here is used for prophylaxis and treatment of African trypanosomiasis. So, its principal use is for the treatment of pneumonia caused by Pneumocystis carinii. So, the principal use of your pentamidine is for the treatment of pneumonia caused by Pneumocystis carinii. And also, it is used for the treatment of African sleeping sickness in specific. Okay, number 26, methylated erythromycin is known as your clarithromycin. So, clarithromycin is a methylated form of erythromycin. They have the same antibacterial activity with erythro. However, it is also effective against Haemophilus influenzae. Okay, methylated erythromycin is your clarithromycin. Number 27, a semi-synthetic aminoglycoside whose structural prototype is kanamycin, that is your amikin. amikin, or also known as your amikacin. It is a semi-synthetic aminoglycoside first prepared in Japan. So, your amikin is first prepared in Japan. And its prototype is kanamycin, or also known, your amikin is also known as your amikacin. Number 28, structural congener of cymetrel, which is used for viral influenza, is your ribavirin. Ribavirin. Your sime from the word cymetrel. Sime means riba. So, sime riba. So, the structural congener of cymetrel for viral influenza is your ribavirin. Number 29, more potent optical isomer of ofloxacin is your levo. Your most potent optical isomer of your ofloxacin is your levo. So, ofloxacin has better oral bioavailability than other fluoroquinoclones, but is generally less active against Enterobacteriaceae and Pseudomonas aeruginosa. So, your levofloxacin, again, is the more potent isomer of ofloxacin. So, olevo, ofloxacin, levo, more potent optical isomer. Number 30, these groups of drugs share the same mechanism of action as that of sulfanilamide but are less effective. That is your sulfones. So, your word here is your sulfanilamide, sulfa, and the answer is sulfones. So, they have the same mechanism of action, however, less effective than your sulfanilamide is your sulfones. Okay, number 31. 31. Mechanism of action of thiabendazole is inhibition of cell division. So, thiabendazole inhibits helminth-specific enzyme fumarate reductase. So, yung ini-inhibit na enzyme ng thiabendazole is your fumarate reductase. So, it inhibits the cell division of your helminth-specific enzyme is the fumarate reductase. Number 32, this anti-burn therapy causes systemic acidosis. Your sulfamylon. Your sulfamylon, again, is the branded name. And its generic is your mafenide acetate. Mafenide acetate, generic name, and the brand name is sulfamylon. Used for anti-burn therapy together with your silver sulfadiazine. So, again, anti-burn therapy, that is for your silver sulfadiazine and your mafenide acetate or your sulfamylon. 33. Drug of choice for filarial infections, that is diethylcarbamazine. Diethylcarbamazine. So, the causative agent of filariasis are first Wucheria bancrofti and Brugia malayi. So, the causative agents of filariasis, Wucheria bancrofti and Brugia malayi. And the drug of choice is your diethylcarbamazine. Diethylcarbamazine. Number 34, active form of sulfonamide is the ionized. So, the ionized salt form is the active form of your sulfonamides. Number 35, the use of crotamidon. Your crotamidon is available in 10% concentration in lotion and cream intended for topical treatment of scabies, and its antipruritic effect is due to its local anesthetic action. So, the use of crotamidon is scabicide and also used as antipruritic. So, scabicide, antipruritic. Okay. 36. Mechanism of action of mebendazole is to decrease the glucose uptake. So, mebendazole, it is a broad-spectrum anthelmintic that is effective against variety of nematode infestation, which includes your whipworm, pinworm, roundworm, and hookworm. So, it is effective against whipworm, pinworm, roundworm, and hookworm. And its mechanism of action is to decrease the glucose uptake in helminths. Ayan. So, 37, a sympathomimetic agent that bind to alpha receptors found centrally that cause suppression of appetite is your Adifax. Adifax, it is a sympathomimetic agent that binds to alpha receptors found centrally that cause suppression of appetite. Number 38, an example of a glycine conjugation pathway is benzoic acid to hippuric acid. So, a glycine conjugation pathway, example, benzoic acid to hippuric acid. Okay, number 39, the following are characteristics of active transport except higher to lower concentration gradient. So, the following are characteristics of active transport except higher to lower concentration. So, the characteristics of active transport is to follow saturation kinetics, expenditure of energy, and carrier mediated. Number 40, these antidiarrheals tend to decrease pore sizes of GIT epithelial to prevent formation of watery stools are your astringents. So, antidiarrheals to decrease pore sizes of GIT epithelial to prevent formation of watery stools, astringents. So, locally, they are applied as protein precipitants. However, they are used therapeutically to arrest hemorrhoid, to check diarrhea, reduce inflammation of mucous membranes, promote healing, toughen skin, or decrease sweating. Okay, number 41. This antihistamine possesses the same indication as that of diphenhydramine, that is your dimenhydrinate. So, dimenhydrinate has the same indication as that of diphenhydramine. Other antihistamines, your cyclizine and meclizine. your meclizine, your hyoscine, diphenhydramine, dimenhydrinate, your cyclizine, and your meclizine are effective in the prevention of motion sickness. Your diphenhydramine, your dimenhydrinate, your cyclizine, and your meclizine are used in the prevention of motion sickness. Okay. However, your dimenhydrinate has the same indication as that of your diphenhydramine. Okay, number 42. The metabolism of warfarin is induced by following except your tolbutamide. Number 43, fertility vitamins are your alpha tocopherol. Your alpha tocopherol is also known as your vitamin E. Vitamin E. It is often called as the anti-sterility vitamin. Anti-sterility vitamin or fertility vitamin, that is your vitamin E, or also known as your alpha tocopherol. Number 44, calcitriol, a hormone responsible for enhanced absorption of calcium from the intestines, is synthesized from vitamin D3. So, vitamin D3 is not the act itself as the active form of the vitamin. Together with calcitriol, promote or enhance the absorption of calcium from the intestine. So, calcitriol plus vitamin D3 enhances the absorption of calcium from the intestine. Number 45. A metabolite of chloral hydrate is your trichloroacetic acid. Trichloroacetic acid is a metabolite of your chloral hydrate. So, your chloral hydrate here is used as a hypnotic. Number 46, a sample drug excreted via saliva is your lidocaine. So, the excretion of your lidocaine is through saliva. Number 47, a vitamin A derivative used in the management of psoriasis is your Tegison. That is your etretinate. Brand name Tegison. It is a vitamin A derivative indicated for the treatment of recalcitrant psoriasis. Treatment of severe recalcitrant psoriasis. So, your Accutane here, Accutane is the brand name of isotretinoin. Your Accutane is the brand name of isotretinoin. Your Retin A is the brand name of tretinoin. Retinoic acid or Retin A is the brand name of tretinoin. Your Accutane is indicated for the treatment of severe recalcitrant cystic acne. Your tretinoin is for the treatment of acne vulgaris, topical treatment of acne vulgaris. So, let's repeat. Retin A or retinoic acid is the brand name of tretinoin, and it is used for the treatment of acne vulgaris as a topical. So, Retin A is a topical used in the topical treatment of acne vulgaris. Your Tegison is the brand name of etretinate, which is for the treatment of severe recalcitrant psoriasis. And your Accutane is the brand name of isotretinoin for the treatment of severe recalcitrant cystic acne. Okay, number 48. Structurally specific drugs are those whose activity depends on ability to bind on a specific receptor. So, structurally specific drugs are those activity depends on the ability to bind on a specific receptor. Okay, 49. The most potent antibacterial alcohol is the primary alcohol. So, the next most potent is your secondary, and the third is tertiary. Okay, primary, secondary, and tertiary. So, the most potent is your primary alcohol. Number 50. Product of acid hydrolysis of penicillin is your penicillinic acid. So, penicillinic acid is the product of acid hydrolysis of penicillins. Number 51, Sidex. It is the commercial product for glutarol disinfectant solution, which is your glutaraldehyde. Sidex is the commercial product for glutarol disinfectant solution, generic name glutaraldehyde. Okay. Number 52, presence of electron withdrawing groups attached to the alpha carbon of the amide side chain in penicillins render acid stability. So, the presence of electron withdrawing groups attached to alpha carbon of the amide in penicillins render acid stability. Number 53, attachment of bulky groups to the alpha carbon of the amide side chain in penicillins render penicillinase resistance. So, attachment of bulky groups to alpha carbon of the amide side chain in penicillins render penicillinase resistance. Okay, 54. A glycopeptide antibiotic is your vancomycin. It is a tricyclic glycopeptide effective for the treatment of multiple drug-resistant organisms such as methicillin-resistant staphylococci. So, vancomycin, it is effective against multiple drug-resistant organisms such as methicillin-resistant staphylococcus or staphylococci. Number 55, a tumor is benign if the tumor mass may be removed by surgery and regression of remaining cells occur. So, the three definitions, your A, B, and D, that is for malignant tumor. Also, for benign tumor, metastasis is not evident and cells originating from the tumor do not invade other tissues or cause damage to the surrounding tissues. Okay. Kapag malignant tumor naman, metastasis is evident and the originating tumor may invade other tissues and cause damages, and also it will cause damages to surrounding tissues. That is your malignant tumor. Okay, number 56. 1 gram mass of tumor is equivalent to 1 billion cancer cells. Okay, memorize that. 1 gram mass of tumor is equivalent to 1 billion cancer cells. Number 57. The following are mucolytics except for caramifen. So your bromhexine, your acetylcysteine are mucolytics, while your caramifen is an anti-tussive. So your bromhexine and your acetylcysteine are mucolytics, while your caramifen is an anti-tussive. Number 58. The side effect of steroids used for asthma are minimized when the drug is given via inhalation. Okay. The common side effects of long-term corticosteroid therapy are negative calcium balance, which result to osteoporosis, impaired wound healing, increased risk of infection, increased appetite, hypertension, edema, peptic ulcer, euphoria, and psychosis. So, this to diminish or to minimize the side effects of your corticosteroids, they have to give the drug via inhalation. So, if this corticosteroids is given orally and intravenously for a long-term therapy, the side effects are your osteoporosis, increased risk to infection, increased appetite, hypertension, edema, peptic ulcer, euphoria, and even psychosis. So, nakakabaliw ang long-term, oral, and intravenous corticosteroid therapy. So, the only remedy here is to administer them via inhalation. Okay. Number 59. A progesterone derivative which is used for the treatment of endometrial cancer is your Depo-Provera. So, the treatment for endometrial cancer is Depo-Provera. That is for the palliative treatment. At kapag hindi na naagapan using your Depo-Provera, the only treatment left is surgery. So, the only treatment left is surgery. So, habang maaga pa at nalaman nila na meron silang endometrial cancer, pwede pa siyang agapan ng Depo-Provera. Okay? Number 60, drug of choice for absence seizure is your ethosuximide. Ethosuximide. DOC for absence seizures. Always take note for the drug of choice. Kung di siya lumalabas dito sa Organic Farm Chem, lumalabas siya sa Module 6. Microbio and QC. Module 6. Okay. Number 61. An antioxidant added in food products which are potent carcinogens is butylated hydroxytoluene or your BHT. So, your BHT, it is an antioxidant employed to retard oxidative degradation of oils and fats in various cosmetics and pharmaceuticals. However, it is a potent carcinogen. Okay, butylated hydroxytoluene. Number 62, pentavalent antimony in the presence of hydrochloric acid gives a violet precipitate with this pink dye, which is your rhodomine B. Pentavalent antimony in the presence of HCl gives a violet precipitate with pink dye known as your rhodomine B. And the chemical name of your rhodomine B is para-nitrobenzene azoresorcinol. Para-nitrobenzene azoresorcinol, or your rhodomine B. It gives a violet precipitate with pentavalent antimony in the presence of hydrochloric acid. So, number 63, expectorant obtained from phenol volatile oil of Fagus grandiflora is your guaifenesin. So, guaifenesin is derived from a phenol volatile oil of Fagus grandiflora. So, your guaifenesin is used for symptomatic relief of respiratory conditions characterized by dry, non-productive cough and the presence of mucus in the respiratory tract. 64. Mescaline is a phenylethylamine derivative. This mescaline is regarded as the first of a series of hallucinogens or psychotomimetics. So, first regarded as hallucinogen or psychomimetics. Chemical name of your mescaline is 3,4,5-trimethoxy beta phenylethylamine. 3,4,5-trimethoxy beta phenylethylamine. Okay. Number 65, anesthetic of choice for labor. Anesthetic of choice for labor is your methoxyflurane. Methoxyflurane. Most potent inhalation anesthetic because of its high lipid solubility. So, take note, your methoxyflurane is administered via inhalation because of its high lipid solubility. Okay. Prolonged administration is associated with metabolic release of fluoride, which is toxic to the kidneys. So, methoxyflurane is used outside of obstetrics practice. Okay. So, that is the choice for labor. Number 66, the drug of choice for acute attack of migraine is your avamigran. Avamigran. Your avamigran is the commercial name for ergotamine. Ergotamine. Okay? Ergotamine or your avamigran is the drug of choice for the acute attack of migraine. So, number 67, anesthetic of choice for patients with asthma is your enflurane. Enflurane, anesthetic of choice for patients with asthma is your enflurane, while your methoxyflurane is the anesthetic of choice for labor. And the drug of choice for the acute attack of migraine is your ergotamine or your avamigran. Number 68, propionic acid derivative is your naproxen. Naproxen. The first propionic acid derivative to be available in the US is your ibuprofen. So, the first propionic acid derivative available in US is your ibuprofen. and joined by your naproxen, phenoprofen, ketoprofen, florbiprofen, and oxaprozin. Okay, so your fen, and xen are your propionic acid derivative. Okay? Number 69. An example of iodophore. An example of iodophore is your povidone iodine. Again, your betadine. Number 70. Phenylmethanol. Your phenylmethanol is also known as your benzyl alcohol. So, it is found unesterified in oil of jasmine and as esters of acetic acid, cinnamic acid, and benzoic acid. Okay, benzyl alcohol is also known as your phenylmethanol. Number 71, a characteristics of cancer cells, lack of normal growth controls. So, a characteristic of cancer cells is their lack of normal growth controls. Number 72, carcinogenic substances obtained from paper is your polychlorinated biphenyls. Polychlorinated biphenyls are carcinogenic substances obtained from paper products. Carcinogenic meaning they can cause or they are cancerous. 73. Prostaglandins are also known as your eicosanoids. Your prostaglandins are also known as your eicosanoids. So, they are group of naturally occurring 20-carbon fatty acid derivatives. So, they are one group of naturally occurring 20-carbon fatty acids. So, again, they are also known as your eicosanoids. Number 74, which of the following functional group is the most basic? Most basic is your amine. Number 75, derivatives of benzyl sulfonylureas are oral hypoglycemics. Your derivatives of your benzyl sulfonylureas are your oral hypoglycemics. So, the drug of choice for the treatment of non-keratosis prone mild diabetics are your sulfonylureas. Your sulfonylureas or your oral hypoglycemics are still the drug of choice for non-keratosis prone mild diabetics. Number 76, a necessary precursor of visual pigment is retinal. The word visual pigment, that is your retinal.